Hi guys, I just want to talk briefly about the drug handbook guide. So if you can click on it and open it up, I'll go over it with you briefly just so you know how to use your drug handbook or how to use the drug monograph. So your drug handbook is basically arranged alphabetically. And when you open it to your desired page, whatever that medication you're looking for, you will basically see this similar page. So this is a drug monograph. So as you can see on this page right here, let me make it a little larger. For example, this is the drug propranolol hydrochloride. So it goes by the generic name. So if you're trying to look for a medication, if you can't find it, try to look for the drug based on their generic name, not their brand name or trade name. So you have here, this is again the generic name of the drug. And as you can see on the top part, it has the safety concerns. So here is a safety alert. That is followed by the pronunciation guide. So here's the pronunciation guide, and you have the different brand names or trade names available. And you have your therapeutic class, which is this one, because we're going to be asking you the therapeutic class of medication. So in this case, this is an antihypertensive. Followed by, over here, the pharmacologic class. So again, in this case, for propranolol hydrochloride, this is a non-selective beta blocker. So not related to this drug, but just an example, if there are any biosimilar drugs available, it will indicate it there. So for example, for this specific drug, it will indicate biosimilar drug. A very important information that you also would like to know when you're looking for a drug, or you're looking up a drug, is the mechanism of action or how the drug acts on the body. So it's under here, action. So this is, for example, for propranolol, this is the mechanism of action. It also gives you information on the route, and depending on the route, what's the onset, peak, and duration of the drug. And over here, you can also see the half-life of the drug. Now, if there's any new approved FDA indication, it will also indicate it there, just like for this one. So new FDA approved indication and dosage. And over here, it includes only evidence-based off-label uses. So in addition to label uses, so the typical use of the medication, if there's any off-label use that's approved or evidence-based, it will include it here. Oh, and if you can see this, let me make it a little larger. The symbol right here, this highlights monograph with key genetic information. So if there's anything genetically that you need to know, it will indicate here with this symbol. And if you would like to find the administration section, this will cover all applicable routes by which the drug can be given. So over here, with this specific drug, it has PO or by mouth, and you also have IVs and etc. So depending on how you administer this specific drug. And in addition to that, if it's an IV medication, it will include highlights on need-to-know information for IV administration. Just like this one over here. And we already went over actions or mechanism of action. Now, if you want to know side effects or adverse reactions, so for your drug handbook, a lot of it is actually sort of mixed together. I know we differentiated side effects versus adverse reactions on during your lecture, but on your handbook, sometimes it's mixed together. So if we're asking for adverse reactions, or side effects, this is where you can find those. Now, when we're asking for it, please take in consideration what's going on with your specific patient. So be specific, make sure it's personalized for your patient. Don't just write down the first adverse reaction or side effect that you see in the drug handbook. Take in consideration what's going on with your patient, right? So make sure that that's a pertinent or important side effect or adverse reaction that you want to know with regards to your patient and that specific drug. So this is where you can find adverse reactions / side effects. Now, the drug handbook will also give you some interactions. So it lists down potential interactions with other drugs, herbs, and lifestyle factors. As an example, this is for propranolol. So it has the drug-to-drug interaction, you have the drug-to-herb interaction, and drug lifestyle interaction. Now, if you go to effects on lab test results, this will list down how this medication can affect your patient's blood work or labs, as indicated over here. So effects on lab test results. So if that's something that you want to know or is pertinent to your patient. And I think this is a very important information to know, especially as you progress and start going and doing your clinical rotations. This is something that you want to look at. Now let's go back up. Remember the black box warning. So if the medication you're looking for has a black box warning, you can easily find it here. So it's easy to spot black box warning. And it will list down, what's going on with this medication. Another good thing about this drug handbook, it can tell you if this medication can be dialyzed, especially for your kidney or dialysis patients. So for this one, it says dialyzable drug, and it says no. So this is not dialyzed. And in case of overdose, it can also list down known signs and symptoms of medication overdose. So for this medication, it has bradycardia, cardiac failure, hypotension, bronchospasm. Now, if you want to know if it can affect pregnancy, lactation, or reproduction, remember what we talked about in Unit 2? This is where you can find it. So it highlights pregnancy and lactation and reproduction concerns. So if there's anything that we need to know about this drug when it comes to pregnancy, lactation, and reproduction, this is where we can find it. Now, something that I really like about this specific drug handbook, and actually some other drug handbooks have it too, is the nursing considerations. So it gives you things to consider as a nurse. Now, if you can see this alert section over here, it does point out critical information that can't be overlooked. So this kind of tells you, hey, nurse, make sure you pay attention to this. And if you can remember again what we talked about medication names, and it can be confusing, this has this section, look alike, sound alike. So it identifies the drugs with similar appearance or name as this current medication. Now lastly, it also has patient teaching information. So it lists most important information that your patient should know. And I think this is also very important for you to read because it helps you know what to tell your patients whenever you're administering that medication. Anyway, well, this is it for the drug handbook guide. So I hope this will help you find the information that you need for your homeworks and also for your clinical rotations and for everything else whenever you're looking at a drug handbook. Oh, what I forgot to mention is, sorry about that, it also gives you the available forms of the drugs, and if you notice, there's going to be different icons that will be shown, and let me show you here. So here it says Canada, so medications are available in Canada. This symbol right here is over the counter. This means off-label. This is a photo guide, so if there's any picture. And over here, it's not as clear, but I believe that says DNC or do not crush. And this says liquid contains alcohol and then genetic. So this is the label. So if you see these icons, this is what it means. And if you go back over here, let me go back to the available forms. So you have, for example, for this medication, capsules extended release. If you see this icon over here, DNC, so do not crush. So this medication, if you're preparing it for a patient, you make sure that you don't crush the medication. And lastly, the indications and dosages. So these are the list of indications or the reasons why this medication is prescribed or used for this patient. And depending on what's the indication, there are different dosages pertaining to that. So an example would be, this is for angina pectoris. So this would be the common dose for this for adults would be 80 to 320 milligrams. So there's going to be different indications for different drugs. And so for each indication, usually there's a designated dosage for that. See here. And another thing that I forgot to mention is that if there's any incompatibilities, it will also indicate in the drug handbook. So anyhow, make sure you pay attention, read your drug handbook, get familiarized with it because you're going to use it a lot, starting from level 1 all the way to level 4, and you may even use it as a nurse once you're done with nursing school. So definitely be familiarized with your drug handbook. Anyway, that's all. Thank you.